Good morning, everyone, and thank you very much for joining our session this morning, which is entitled Driving the Digital Transformation of Health Now or Never. I'm Jan Philipp Beck. I'm the CEO of EIT Health. EIT Health is a community of innovators that brings partners together to innovate and develop new solutions in health. We have currently about 150 members from all around Europe. Around a third of them are from industry. The consortium is then complemented by the universities, research organizations, healthcare providers, of course, regions, and also payers, and a large ecosystem, of course, of also startups and entrepreneurs around us. Needless to say, we are always open for new members to join us on our journey. Now, digital solutions play, of course, a very important role, and a lot of the work that we do underpins many of the innovations that we bring forward. Now, the title or the digital title of our session is Now or Never. So why is it now or never? Well, I think at this moment in time, needless to say, all eyes are on health. Needs have become very evident over these past months, and there's pressure. And that pressure thing also brings a unique moment to bring policymakers, payers, and innovators together who all feel this pressure and who all feel the need to contribute. And we have the expectations out there, the expectations from people, from patients and citizens that are expecting that we make things better, that we improve health, and that we also, in particular, improve the resilience and also the sustainability of our healthcare systems. And at the same time, I think we can also observe that there is a greater and greater readiness to embrace digital solution, which is an opportunity as well at this very moment in time. So in this session, we want to discuss what the digital transformation can look like. And on that note, I would say, let's hear it. I would like to introduce to you our Director of Innovation at EIT Health, Jorge Fernandez, who is going to guide through the session, moderate it, involve you from the audience, and of course also he's going to introduce our distinguished panel. So without further ado, Jorge, over to you. Let's get started.
Thank you very much, Jan Philipp, for this nice introduction. Good morning, good afternoon, good evening, depending where you're sitting in the world. This is one of the beauties of online. You can be listening to us in the US, in China, in Africa, or in a place in Europe. The session today has a great title, but I really like this James Bond type of title. It's now or never, right? And I think it is the time where digital health has become, let's say, the center of all the eyes, as Jan Philipp has said. And the most important thing is that we have already countries, regions, hospitals, startups delivering on the promise. And we brought a bunch of them here to share with you the experiences, the difficulties, the challenges ahead, and things that innovation, the first thing is to copy. We should not be ashamed to copy the things that work and avoid the things that don't work. So with that, I'd like to introduce the panel today here. First, I'll have here with me Julia Hagen. Julia is the Director of Regulatory and Politics at the Health Innovation Hub in the German government. Thank you, Julia, for joining us. Good morning. Good. We also have here with me Lydia Montandon. Lydia is the Business Development Director at Atos, one of the largest companies in Europe in digital. And she's also a member of EIT Health Supervisory Board. Thank you for joining us, Lydia. Good morning. And on top of that, we have two CEOs and founders, Hans and Luis. Hans, he's the CEO and founder of a startup called Smart for Diagnostics. Good morning, Hans.
Morning from Munich.
And Luis is the CEO and founder of a startup called iLove, in intelligent lab on a fiber. Good morning, Luis.
Morning, Jorge.
Very good. So the session will be divided into 3 blocks. In the first part, we'll get the country perspective. So we'll get Julia to talk to us about their experience in Germany with the digitalization and the Digital Act. Let's say that I think is going to be very, very interesting part of the meeting today. Then the second block, it will be a conversation between Lydia and the industry, let's say, perspective, and Julia, the government perspective. I think that's going to be enriching. You know, EIT Health, we thrive on the interfaces. That's where we really add value, and this is where the real conversations need to happen in healthcare. And then the third block will go directly to the startups. You know, we want them to share with us what they're doing, you know, what the challenges they have, and you know, what are the opportunities for digital health moving forward. So with that, stay with us. It's going to be very interactive. There's going to be lots of questions. You know, have your fingers ready for the polls. We have several questions ready for the audience, and we really want to know the answers to those, right? So with that, I think we're ready to start. So I can ask you, you know, to mute your cameras, let's say, and your mics, and then we'll get Julia moving on.
Thank you, Jorge. Thank you for the introduction. Thank you as well for the kind invitation to speak at the session. I think it's a great opportunity, and it's a great title for a session, because this digital transformation, now or never, I think that's something that is driving us at the Health Innovation Hub, and me personally as well. I want to give you a short overview of our work at the Health Innovation Hub, and more particularly on some of the more recent developments, and sort of the context that is also sort of pushing and driving this transformation at a pace that we might not have expected a couple of years ago. Before I kick off, I could have shown you for roughly 30 minutes how bad Germany has been performing in this digital transformation, and how much we are lagging behind. I spare you those 30 minutes, because I think you're very well aware that Germany is rather at the bottom of the ladder when it comes to the digital transformation of healthcare. The past 15 years, we have had a difficult time, actually. What has happened now is sort of not the only reason, but something that has been introduced as sort of a means to drive this change and to accompany this digital transformation, is the foundation of the Health Innovation Hub. So we are a small unit of 12 experts from different backgrounds, interdisciplinary fields, data science, physicians, pharmacists, IT experts, regulatory experts, lawyers, data privacy experts, all kind of experience and expertise you need in order to be able to accompany this development. And we have been created by the Health Minister Jens Spahn himself as a task force to accompany the Health Ministry and major stakeholders in this digital transformation. So this means we support in the development of the regulatory framework in order to enable this digital transformation. And we also support in the implementation and then the realization of what has been written as a text in a law, and then needs to come to life actually for patients to be experienced, because that is that what is very much at the center of our ambition is we want this digital transformation to be experienced by patients in their everyday life. Of course, the digital transformation is about many, many aspects in healthcare. It's about infrastructure. We could talk about that for hours as well, but I want to look at a very particular aspects of the digital transformation, and that is how care delivery and how therapeutics and diagnostics is being transformed by digitalization. What we have seen in the past is that there are numerous innovative product solutions out there in the market. Many of them have been out there for more than 5, 6, 7 years, but they really had a hard time in Germany to fit into the regulatory scheme. So as you can see, you don't need to know those paragraphs. That's all from the German social code, and not even all Germans are very keen on reading the social code, but they have been very fragmented some solutions for some individual health insurances for digital solutions to become a part of care delivery and of the life of patients, but it has been fragmented and it wasn't a real good fit. So as a result, digital solutions remained sort of an accessory, not really an important part of care, of the work of physicians, of other healthcare professionals, and neither of patients. So what the government then did is introducing a new category of care delivery, a new category of care with the health, the Digital Health Care Act, the Digitale Versorgungsgesetz, that was passed at the end of 2019, which introduced sort of as a complementary type of care, it introduced next to drugs, next to therapy, it introduced digital health applications, DIGA, as a means of providing care and of treating patients, so to say, to as an instrument to physicians and psychotherapists. So very briefly, what do you need to imagine by a DIGA, by a digital health application? They are medical devices of a low risk category, so class 1 or 2A. They are intended to be used by patients, so they're really centered around the patients. Of course, they can facilitate the interaction between physicians and patients, but they are not considered as something that supports physicians, for example, in decision making or decision support system. It's really targeted to patients. Then it has to be, a DIGA is a medical device and it has to rely on digital technologies. So we are not talking about classic traditional medtech that comes with a software accessory, but we're talking about digital products that may have a hardware component, but that is digital. And lastly, those DIGA have a variety of functions that is very broad, ranging from diagnostics to therapeutic functionalities, excluding only very little functionalities. If you are if you have a medtech background, you will know these functionalities and categories from medical device regulation and medical device law. So there's only a few exceptions. So in general, this opens up sort of a new broad range of possibilities for physicians and psychotherapists to prescribe these kind of diagnostic or therapeutic tools to their patients. So examples can be very broad, and we'll look a little bit later at what these examples are. And this also comes, at least from our perspective, with another novelty. That is that, of course, in order for these new digital health applications to be reimbursed and to be provided to patients, they need to meet a certain set of criteria. We're not going to look at those criteria because that's something that we expect in any way from a product that is given to patients. It needs to be safe and secure. It needs to comply with data privacy, data security regulation. It needs to protect consumers' rights and all that. And of course, on top of that, in a system that is based, has a sort of a solidarity approach, as it is the case in Germany, where everyone is in the public insurance system, with a few exceptions, then you want to make sure that these digital health applications have a positive effect on care. And for that, we introduced something that is a novelty. We are defining now these positive effects on care, not only as an improvement in terms of quality of life, reduced mortality or morbidity, clinical endpoints that we are very familiar with, but we broadened the spectrum. And we say, well, we also want to acknowledge the effect of digital tools on structures and procedures that are sort of relevant for patients. So that's, of course, a very abstract term. So I gave you a couple of examples there on the left side. So it's about, can a digital tool that, for example, is a companion for a diabetes type 1 patient that helps to track parameters or other things, gives advice on how to manage the personal health situation. These digital health applications can then be seen to have a positive effect on care because they improve adherence, they improve health literacy for those patients, or they help to coordinate the care between the sometimes complex network of different healthcare professionals, or they may just be a way to reduce the burden of illness in daily life, to make sure that, for example, a chronically ill person doesn't really have to drive maybe to that healthcare professional once a week, once every 2 weeks, but can sort of make sure that the monitoring that needs to take place is been taken care of via digital means. So this is sort of a way to transform as well the way we think at healthcare and the benefits new digital tools can provide to patients. The variety and sort of the broad range of different tools that we are expecting has no limits. As I said, it might be software, it might comprise hardware elements. So we will possibly be seeing many DIGA, many digital application in the field of chronic diseases, where it helps patients to better monitor the condition of their condition, the situation in which they are right now. An example might be, for example, Parkinson's disease, where a patient might be carrying a little sensor that actually detects the way the person is walking and if it's deteriorating or improving. And then the software, so the DIGA, together with the sensor, allows to actually understand if the medication is still well adjusted to the patient's situation, or if for some reason the sensor could detect that the walking has become much worse, and then you maybe need to act. And that's something that otherwise would be very hard to detect by a treating physician. And of course, there are many other examples in the field of, for example, e-mental health for a DIGA that is more therapy-oriented or self-help oriented. And then we see, we're looking forward to DIGA that will sort of close the bridge and the gap between hospital and then the way back into sort of the ambulant care system, which usually is a mess, or often is a mess in Germany, let's say. So we're excited. We expect the first DIGA to be sort of finally approved and then listed to be able to be prescribed by physicians and psychotherapists in October. So in the coming days, in the coming weeks, and we're waiting for many more to come. But as I said, of course, this cannot be everything. And here comes sort of one of our next very big projects, because the DIGA, the digital health applications, have kept us very busy during the last year, but it was fascinating, and it's really exciting still to see how this is developing. But the next topic is already up, and this is a topic that has been very much pushed forward because of the pandemic as well. And it's sort of a window of opportunity to now push for more digitalization in the hospitals as well. And the parliament has passed yesterday a bill, so it's the Senate that has to approve it as well. That is a bill that is providing 4.3 billion euros for the digitalization of hospital, following sort of a meaningful use approach somehow, where we want hospitals to use that money. They may use that money in order to invest in all those different types of services that you can see on that slide here. So we're very excited, and we see this as another component, another piece of the puzzle that finally leads to a more holistic digital transformation of the healthcare system. And so stay with us, and hopefully we see many solutions also from other countries within Europe that come to Germany to become a DIGA and to be part of the German healthcare system and to be provided to patients, or solutions from other countries of the world and from Europe that will provide the services that help hospitals to become more digital, to support them in the work they need to do during a pandemic, and also on a sort of a daily basis when there's not a pandemic around the corner. And I think that's That's everything for me. If you want more information about our work and what we're doing, have a look at our magazine online. And if not, reach out to us via social media or email. We're always looking forward to learn and to hear from other parts of the world and our neighbors. Thank you.
Excellent presentation, Julia. Thank you very much for kicking this off. Terrific what you're doing. Really looking forward to the October, to this announcement. Really looking forward to that and the result it brings up. Briefly, can I ask you just two questions to you very briefly? I'm just going to allow you to answer with one sentence. What has been simpler than expected in this digital transformation journey, and what has been tougher than expected?
I think nothing has been simpler than expected. And especially I think the cultural change, changing the way people used to do things or have been doing things their whole life, that's much more difficult, even more difficult than we expected. As a very brief answer.
Very good. So basically, bottom line, humans are more difficult than technology. Fully supportive on that. Very good. Thank you very much for that. Let's open the polls to the audience. We have a couple of questions for you. Let's jump into the first one, please. Let me read it for you. How long do you think it will be until another European country follows Germany's strategy or something similar to Germany in this journey to digital transformation? 2021, 2022, 2023, later than 2025. I'm really happy to hear that, what you said, Julia. I was digital health director for a large pediatric hospital for 10 years, and I would have loved to be, to have that regulatory framework or policy framework around digital. So really looking forward to that.
I think it's really interesting. It will be very, very interesting to see how physicians and healthcare professionals are going to embrace these new possibilities. We sort of see, of course, what you perceive most are the extremes. So we see, of course, some physicians and some physicians associations that are rather critical. They see many risks. They see especially, of course, we are in Germany, the data privacy issues that could come up with those digital health applications. And then on the other hand side, we receive emails and calls from individual physicians, from hospitals who want to know if there's already a digital health application in their fields, and who want to learn how they can go about prescribing them. So it will be very interesting how this works. But of course, we also need to be realistic. It will take time before this will be something that has become a part of the routine of an average physician or psychotherapist. So this will take time. We are very well aware of that. But we hope that there will be sort of many first movers who are willing to try and to learn together with us, because we know, of course, also that this is not the perfect framework. Probably we will learn a lot and have to adapt and might have to change things.
Absolutely.
Yeah.
Absolutely. Very good. Thank you, Julia, for that. Let's hear from the audience. So basically, here are the results. So 38% of the people think that next year, one European country will follow the same policy, approach that Germany did. Then 28% they believe it will take longer than 2025. This is really negative people. Oh my God, this is 5 years down the line. Let's hope, fingers crossed, that things move forward. 2022 is 26%, and then very few people. So it looks like majority of the people think that in the next 2 years we'll see the next country moving forward. Very good. Let me move to the second question for the audience. Which European country do you think it will be? Would it be France? Would it be any of the Nordic countries? Would it be Estonia, which is also a key player in digital? Would it be any of the Benelux countries? Would it be Switzerland or Austria, usual partners of Germany? Would it be any of the southern pigs, Portugal, Italy, Greece, Spain? Would it be the island, UK, Ireland, or others? This is Julia. Can I ask you, who do you think it will be?
Well, so we have been exchanging, of course, with many of those countries as well. And I'm aware that so Belgium is working on a framework, or has been implementing a framework. Of course, not the same, but something similar. Of course, there is UK with the NICE framework, which is a bit different, but is also a way to integrate those some form of digital health applications. We've seen that France has recently added something that we would call DIGA to their catalog, a monitoring solution post lung cancer, if I'm not mistaken. So I think many countries are they're on their way as well. I think what will be very interesting is, are we going to end up with very, very different approaches, or is there some chance of at least a partial harmonization, especially given that with the medical device regulation, we do have a sort of a joint regulatory base for medical devices. We do have the GDPR. But of course, with the requirements, we also went sort of GDPR plus in Germany. So it's, in the end, in reality, it's never as easy as you would expect.
Very good, very good. So let's hear from the audience. So very interesting. Almost 50% of the people, 43% of them, they think it will be the Nordic countries. That's interesting. Julia. UK, Ireland, only 2%. We don't have any, British people here, but it's interesting. And then the second one after the Nordics happens to be the Benelux. So maybe the Belgium or the Netherlands, always very, very advanced players on that. Very good. So thank you very much, Julia. It's been an honor, a pleasure to hear your experience. Let's keep in touch as always, and the audience as well. Please reach out to Julia if you have any questions or comments or things. So thank you very much, Julia, for that. And then I'll call Lydia Montandon on screen, not on stage. Lydia, good morning again. Lydia is, as I said, the Business Development Director of Atos. Lydia, you've been listening to Julia, and you've been hearing me answering the polls. What are your thoughts? What bells does this ring?
Okay, so yes, very interesting presentation. Thank you. Maybe just to give you a little bit of background, Atos is a very big company, so global and specialized in digital transformation. Of course, not only in healthcare, but healthcare is one of the industry we are dealing with. And in healthcare, we propose some digital solutions using the technologies, and we think that the technologies are already quite advanced to offer services such as management of healthcare, of health medical records, or also services to improve the efficiency of healthcare pathways and help organization with their clinical service desks and so on. And also, we consider that the data is at the heart of this transformation. But I must recognize that in Europe, we have difficult conditions, and we have experience in the US, and it's like a little bit smoother. And the reason for this is maybe, as also Julia mentioned, we have quite some regulations, especially the legal and the ethical regulations. The GDPR has been mentioned, and I don't think this is it is not bad. On the contrary, it's very good, and it's very good for the users, the persons. But somehow it's so powerful that it's hindering or not helping with the adoption of technological solutions. So, for example, it's almost difficult for hospitals to store data out of their organizations, such as taking advantage of cloud services, even if it's private clouds. So it's difficult also to share data among hospitals. And then I will have maybe a question for Julia, where the data from those applications to the patients or to the citizen is stored. And second, we have in each country has the control of its own territory. So effectively, we may have solutions for each country, but even if I take the example of Spain, which you probably know well, where there are 70 regions and they have total autonomy with their health policy. So it's very difficult to have a common, let's say, shared view, which if we take the example of the US, the critical mass is much bigger, so the adoption is also easier. So maybe as a proposal or suggestions, alternative ways, find ways, as I think the example of Germany is very good, to empower citizens and patients. So maybe overcome those regulations, making them more flexible, even if data cannot really be stored in the electronic health records, but the benefits they feel, they understand them for their own sake, already is a good step that maybe will allow to make the regulation a little bit more flexible and overcome this low barrier or legal barrier. And another issue that I'd like to highlight is that there is the redesign of clinical processes, and maybe this is the next step now in the journey of Germany. The last slides that was shown by Julia. Currently, they are not designed to take into account new ways of consultation, like a mix of remote and on-site consultation. And I also saw a comment in the chat that there is this overload of physicians. And because it's not designed, they have not a process fully designed, taking into account what technology can bring in to help them. So they need to have reserved time for maybe remote and physical consultation, and also to allow this real collaboration among physicians, because a patient path may need different physicians to collaborate among each other, and the technology there can be of much help, but it should be included or designed in the process of the organization of the hospital. So, well, for the moment, that was my comments. I'm happy to discuss with you, and thank you very much for giving us the opportunity to participate in this debate. Over to you.
Thank you very much, Livia. Very interesting points. Very interesting question. Let me just hand it over to Julia. Where is data stored in these DIGA applications?
Well, sort of depends on what layer of the question. I mean, are you asking yourself how are patients? Well, or one step back. So a DIGA, of course, needs to be compliant with GDPR. And then we have a current issue, of course, with the European Court of Justice decision on Schrems II. So there is an issue in terms of data storage, and a DIGA cannot transfer data to a third country, the US, for example, in this case especially, on the basis of these standard clauses. So there's an issue now that data can only be stored. So as a DIGA manufacturer, you can store your data in the EU or in a country where there is an adequacy decision. So that's sort of one issue, and that is something that has, of course, come up and also made the whole process a bit more complicated in the end. But we are working with what we got, and of course you need to take those developments into account. And well, I mean, of course you could have argued we maybe could or should have foreseen the possibility of a Schrems II, but well, we got to work with it now. Then sort of on a second level, the question is storing the data in a DIGA. So if I'm using a DIGA on my smartphone, what I want to share that data with my healthcare professionals, of course. So then there are different possibilities. So either, and that's the case for those DIGA that work with healthcare professionals a lot, especially in the field of monitoring, for example, they provide an interface as well for the physician. This, of course, if you look at that from a physician's perspective, that's not the optimal solution, because you don't want to log into another interface web portal, especially not if maybe you have a series of patients, if you have patients using maybe a certain selection, maybe 5, 6, 7 different DIGA that you work with in your field, and you don't want to log into 6, 7 portals to look at your patient's data. So something that might be not very digital, but it might be handy in terms of how physicians work, is that the DIGAs also provide sort of a PDF that patients can take and give to their physicians. That's of course not very digital, but it will be a way in the beginning to make sure that physicians see from the very beginning, oh yeah, this is useful data that I can integrate into into the treatment. And then we are establishing a personal electronic health record, where the patient decides what kind of data my physician or my physicians and other healthcare professionals see, and the DIGA, all those DIGA will have an API to actually provide their data or their reports, not all the data probably because that's not useful, but reports, for example, to then my personal electronic health record. And the personal electronic health record, that's a very complex undertaking as well, is very much integrated into the software of the physicians, so that they can then just during their regular work pull up the PDF, or of course in an ideal world is more structured, maybe a PDF with CDA at the inside, for example. So structured data in the inside, and then look at that, use the data, store it, or just consult it. So that's sort of the idea, and that's something that DIGA need to be compliant with by 2022. So not for 2021 yet, but it's on the roadmap.
Okay.
Very good. So that was a very interesting, because you just put the let's say there are different layers here, right? Before, the question is where do you store it, right? So you have there's a geographical, still question, precisely what you're saying, and it has to be in Europe, and then that's one thing, right? Then the second thing is, where exactly, right? Is it in the device? Is it in a private cloud? Is it in a public cloud? Is it hospital when they're doing things? Is it in the local systems, right? So there's these two layers that are interact. So that's very interesting. Very good. So Livia, let me go back to you on that one. So we heard from let's say from the government side, let's say, right? From an industry perspective, and Atos being one of the top let's say digital software companies in Europe, what thing would you ask national, regional health systems to do so everybody can achieve full benefit from digital health? What would that be?
So you asked me for a wish list. That's a very good opportunity.
Just one. Give me just one.
Oh no, I have many. Okay, maybe one of the most important one would be to achieve interoperability of data. As we mentioned, and as I said earlier, we see there is a lot of intention of investing by the government, but it's very complicated to move forward without this interoperability. And also there is, in some professional sectors, this still unwillingness to adopt a more standard way and share this data across the department, across between doctors, and really achieve this interoperability that would be really a good asset between hospitals. And that would be, let's say, the main request.
Very good. It's a good one indeed. Julia, is interoperability on your wish list as well, on the Amazon wish list as well?
Sure, yes.
Tell us a little bit.
We have, so in primary care, so physicians and psychotherapists in Germany alone use 160 different software products.
Not bad.
I'll just let this there. No, that's a number, and of course that's a huge issue. With this personal electronic health record at the center, the idea is that software in hospitals and in primary care they need to use standardized APIs so that they are able to communicate. We are slowly moving to FHIR and HL7 when it comes to standards. We just recently joined SNOMED, so definitely Germany is still very much at the beginning, because we have been very, very bad at interoperability during the past years. Because I see on the chat that no, Estonia is much better. Yes, of course, Estonia is far ahead, like 10 years, definitely. But we're just happy that finally something is happening in Germany. And interoperability is one of the major challenges. And this will, of course, take a couple of years, because it's not yet in the systems, and physicians. Someone told me once that changing a software in the primary care sector feels like a divorce for a physician. So they will do everything not to go through it. And so there's a lot of work to do to make it easier for physicians, maybe also to change their system when they're not happy with it anymore. And that will take a couple of more years. But there have been many regulatory or legislative changes in the past years that forces software to open up, to use standards and to be compliant with the standards and tools that have been defined.
Very good. Very good. Thanks for that. Let me ask a couple of questions more to you, and then we'll open up to the audience. There's a few interesting questions coming up in the chat. It's more difficult to handle things online because you have too many channels to pay attention to. But let me go back to this topic, right? Of let's say interoperability and the long list or the long wish list of things that need to be changed, as Lydia was mentioning, from both sides. So this is a question, for both of you, and then I'll get Lydia first, and then Julia second. What do you think, is, let's say, the mistake that we should, avoid? One of the best, let's say, one of the smartest way to be smart is to avoid making big mistakes, right? To not doing things, right? So it's really, you don't do something stupid and then you really look smart, right? And that's a really good deal, I would say, right? In your experience, Lydia, Atos and yourself have been working, several digital projects. If you were to give one piece of advice, to either regions, hospitals, governments, whomever, what would that be?
Well, I maybe will come back to this example of that Julia started with. It's this interdisciplinary team working across all systems of the hospital and even outside. I mean, we need several multidisciplinary views on the topic to make it work, and people from inside, from outside, patients, everybody.
Very good. In fact, let me add something here, because when Julia was presenting before, she said, when I asked her about, what has been simpler than expected, or easier than expected, right? You said nothing, right? And I was going to say, well, wouldn't that working with this mix of people, interdisciplinary, this group of 12 people, I would have loved to be part of that. Okay, call me next time. Really, I mean, just for the pleasure of really understanding the different points of view, right? So I fully support that, Lydia. That's a terrific piece of advice. Get the different voices, right? Because there's so many angles to this question. It's not just the technology, it's not just the clinical, it's not just the regulatory, it's not just the patient. It's like a lot of things, and you need to put them in the same bucket. And I fully agree. Julia, over to you. What would be the one piece of advice, wisdom nugget for the audience?
There are two.
Two for the price of one. There we go.
First is, don't over-engineer, because we have German style been over-engineering, for example, the infrastructure part of how we connect physicians, hospitals, and everyone. And we have started that 2003. That's so long ago, and we've been over-engineering. We wanted the 100% perfect solution, and this, of course, just don't over-engineer. Get something that has a benefit, and that's the second point. Whatever you build, and that's also something that we that I think was one of the mistakes in the past, or that we may be still struggling with, because of course there are path dependencies and we need to work with the legacy with some sort of legacy, is that make sure that you don't digitalize for the purpose of digitalizing, but that there's a benefit that can be experienced. Because of course, everyone understands that you need an infrastructure to be in place, and that sort of is annoying because the infrastructure itself doesn't provide a benefit to those who participate, to physicians or to other healthcare professionals. But as soon as you sort of get a benefit from that, because you can maybe, I don't know, save on not sending letters anymore to your colleagues, or that you can easily get information, communicate more easily with your peers, then you feel a benefit, and then it's much easier to accept the change. And change always comes, of course, with work and with some burden. And when you only put the fact that we really need this infrastructure at the heart of the discussion, and people don't see why should I get it? I don't know why. And I think that's something that is very difficult. Also very difficult when you try to make people understand why a personal electronic health record is great. People need to understand what their personal benefit is from there, being a patient or physician. So it's all, think about the purpose of what you're doing and who will benefit from it.
Very good, very good. So to summarize, number one was don't make good enough the enemy of perfection, right? So good enough is good enough when you're starting things, right? So you just need to make significant improvements, not aim for perfection. That's very good. Very German, I would say. I have experienced that at EIT Health. So that indeed, that's a good one. That's a good one. Second is don't digitalize everything, right? So maybe the things that you don't need to put effort into that's really good. Let me add a couple of myself, let me jump myself into the conversation. I'm loving it. My experience, running, digital health for a large or top pediatric hospital in Europe was that the best approach was what I called hybrid health. So not digital health, but hybrid. So it's a combination of digital and the right combination of the people, right? And you need to have both of things unless you do that. And that talks to your, let's say, to your change, component, Julia, that you were saying before, right? I used to, to make a joke, in the hospital, which I was running at some point, some 40 projects, right? There, and I can tell you that none of them, so 0 exactly. They started with a healthcare professional telling me, yes, this can be done. All of them say, no, this cannot be done. And I always say that's normal, because negativity and the word no is embedded in innovation, because it's innovation, right? So basically, the first word that people use is no, this cannot be done, and then you do a lot of buy-in, right, to do these things. So terrific pieces of advice. I'm really loving those ones. Very good. So let me jump to the Q&A, to some questions from the audience. There's a couple of ones that I find very interesting. The first one is from Siobhan O'Connor. She's a nurse, and basically she says something that is, I've heard this doubt or this complaint many times. She's like, there's so many gadgets and apps, I don't know what to recommend to my patients, right? And then, so what are your answers, Julia, Lydia? What's the right thing to do here?
Well, that's just very briefly, that was the motivation why we said we need a framework to say those are reliable, they show benefit, and they are safe and secure. That was the motivation why we set up this framework. And then there's also no question of, because today, of course, a physician or a nurse could recommend a tool to a patient, but then it turns out that the patient needs to pay maybe 30, 50 euros per month to use it. That's also not something that we like to see in our healthcare system. So I think it needs to become a part of a regulated healthcare system, which of course slows down innovation a little bit. Of course, there's always pros and cons, but I think that's a way to do it.
Indeed, Lydia.
Yes, but there are still, usually there are prescriptions. No, doctors or physicians prescribe something to the patient. Now, if you do it by your own, then you face this plenty of even medicines. No, if you take this pill or this other pill, nobody tells you what is better or not. I mean, you rely on yourself. So in the end, it's a question, as well, you said it perfectly. It's a mixture of recommendation and of course, doctors should be always at the latest and look at the innovative products that come out.
I mean, that's, of course, I don't think we can expect individual healthcare professionals to scan the market for the latest, greatest solution. So I think we need to institutionalize some sort of support. And something else we're doing is we work closely, or we try to enable the medical associations to start themselves to identify, for example, the medical association for
the mic. Julia, can you just lower your mic? Yeah. No,
apologies.
Excellent.
So we work with the medical associations, cardiologists, diabetes, whatever, and we want to enable them to actually be able to be the organizations, the go-to places if you want to know what you should recommend, maybe even outside of the reimbursement framework as well, because I don't think an individual physician or nurse or other healthcare professional, given the daily load of work, is able to scan the market and feels comfortable making those recommendations.
Yes,
yes. What I mean is that there is a team taking care of scanning. Yes.
Of course, yeah. You need someone to do that. Yeah.
Exactly. I as you were both saying these things, I remember a conversation I had with a physician several years ago, right? And basically she was complaining because it was not that she did not know which was a better app or gadget. It was basically that she didn't know that there was such an app. Okay, so basically, she was complaining, hey, my patient approached me, hey, I've read this in the newspaper, in the local national newspaper, and I want to try it. Why don't we interexchange through here, right? And she didn't know what it was, right? So obviously we need this layer for the reasons you're saying, because it's complicated, and then the layer, these people who are, filtering, let's say looking at the market and filtering the good ones, then the question is, do you need one at each hospital? Do you need one at each region? Do you need one, can we have those, national level? Can Europe play a role in that? So there's different levels. I guess that will start bottom up, and at some point there will be some consolidation, but that's a good. Okay, so very good. Now let me move to the poll, because we have a couple of questions for the audience. Now, let's launch the first question. Please, team. Very good. So question number 3, how well are digital health solutions integrated in your healthcare system, wherever you're sitting now, okay? Not at all, not systematically, so let's say partially, let's say sometimes yes, sometimes not, or in parts yes, in parts no, or they are fully integrated and they are an integral part of the patient journey. Please go ahead and vote. This is a very interesting. I'd like to get the, what do you think it will come up, ladies?
If I knew where the audience would come from, I could make a more intelligent guess. But like this,
they come from Europe. That I know.
Mostly from the north or mostly from the south?
I don't know. I was joking. Yeah. So no, I understand. Lydia, any insights into this?
No, I suppose that if they make a guess, it will be in the middle.
Yes, I think that I would like to study if lots of people, answer on the third one, fully integrated in the patient journey. So that's maybe in Estonia people can see that. Let's see. Okay, let's hope that we get the results. Things are coming very, very interesting in terms of the numbers. So here they are. How well digital health solutions are integrated in your healthcare system. The winner is 70% of them say no, not systematically, but let's say so there is some done. Let's say maybe fully or maybe partially, but that happens. So this is a good number. I really like that one. But we also get 25% not at all. So that's interesting as well. 1/4 of the people, and then 6%, fully integrated. So we're in transformation, as we said before, and it's good that the big numbers are in the middle, I would say. So that gives me confidence as well. Very good. Now let's launch the second question in that panel, or fourth question for the audience, which is, what is more important for you as a citizen, okay, or as a consumer, whatever you consider yourself, or both. Let's say, is it healthcare data sharing? Is it the privacy of your data? Is it the empowerment of you as a patient or as a citizen? Or is it the country or the region's sovereignty over everything? Please vote. And this is a very interesting question, right? They should include it in this European Union-wide polls for our 550 million inhabitants, let's say. Let's see what we got. Any views in here? Lydia, what do you think will come up?
I think the three first are all good, so I hope there is a lot about it. I think the balance is difficult, and I would prefer empowerment to privacy, but of course I also understand privacy. What I would not hope is country or region sovereignty, because this closes a little bit the possibility to have let's say a more flat or more open way of sharing data, which is, I think, very important.
Very interesting. Julia, what do you think?
I mean, I kind of agree. I think it's sort of preserving privacy is a must. I don't think it's something that we can debate. And then, of course, sort of the national sovereignty, that's from a government sort of perspective a bit difficult. I think it's, of course, fragmentation, and that's a bit like in Spain, something we have in Germany as well, where the 16 regions actually have different regulation when it comes to data in hospitals. So we experience now that this is going to be a challenge for the reform we want to implement with digitalization in hospitals, that it turns out that in Bavaria, data may not leave the hospital premises in 2021, which is, of course, very difficult if you want to implement cloud solutions in that case, and if you want hospitals to work together across sites and hospital premises. But that's something that we can't change on a national level, but we hope that this is going to become a bit more harmonized within Germany in that case, even though we do have a GDPR in Europe.
Maybe you'll need to have the cloud over Bavaria, right? So
a Bavarian
data
cloud.
Doesn't leave, let's say, Bavaria.
It's not even about Bavaria. It's about the premise of the hospital.
Exactly. Yeah. That's the main problem. Even between a hospital, it would be so great that they could. I mean, for a patient itself, I go to this hospital today because I'm here, and I have to move to this other because there is a specialist.
Indeed, fully agree. So I have good news for you, at least in our group. Let's say, at least. The numbers I was looking at in a second, because I just discovered that in open, exactly, you can see the poll in progress and enclose the final numbers. So we got 0% for option D, Lydia. So I mean, there is hope, okay, and it's not Obama. So that's good. And then in terms of the other, that's a very interesting. That's a good representation over the three. But the big winner is patient empowerment. So 50%. So basically, people are really looking for being empowered. Some people say that the patient is the most underutilized resource in the whole system. Let's say we just do things on them rather than have them part of the, let's say, ecosystem being perfect. Very good. Data sharing second with 29%, and then patient privacy 21%. That's a strange. That's the one that I voted for. But maybe it's for the reasons you said, Julia. This is a must. That there's no debate here. Let's say so. We do it or we do it. So very good. Okay. So excellent. Thank you very much to both, Lydia and Julia. It's been a great pleasure. A very interesting part of the panel today with lots of things to discuss, and looking forward to keep talking to you offline. Okay, so thank you very much.
Thank you.
Thank you.
Very good. And then I'll progress to block 3, and then let's hear. We've heard from the let's say from the country or the region with Julia Hagen, from let's say the experience from Germany. We've heard from Lydia Montandon from Atos, the experience from industry, and now let's hear from the startups, those people trying to transform the way healthcare is delivered and the way healthcare systems run. Let me call on a screen both of them, Luis and Hans, and so you can, for people who have joined the call, that you can see them back on the screen again, so you see who they are. So here comes Hans and Luis. Very good. And so Hans is from Germany, so he's one of these, I look for excellence, not good enough, so that's good. And Luis is from Portugal, which is, also, with part of the company in the UK. So thank you very much, guys, to be here with us. You're part of that digital transformation journey that Europe and the world is trying to take over in terms of digital. And let's first hear from you, Hans. What it is that you're doing, what's your company doing, which is called Smart for Diagnostics, and then what are the issues behind the transformation journey. Okay, so thank you very much, Luis. I'll ask you to let's say turn off your camera, and then Hans, the floor is yours.
All right, perfect. I hope you can all hear me very well. So my name is Hans-Maria Hein. I'm from Smart for Diagnostics. So no stereotypes. Let's say I'm from Germany, but actually I'm from Bavaria, and we have talked about Bavaria and data, and I could talk lengthily about this, but let's change the subject to this. I hope you can still see my camera. These are sample tubes. So normally if I speak with a big audience, then I ask the audience to kind of, raise their hands who had a sample been taken within the last 12 months. And as you all know, a lot of people raised their hands. In the past, the blood sample was prominent, but now with Corona and COVID, the swab has also become very prominent. So what we are doing as a startup and how we were born as a startup is in the lab. So we worked with human blood samples. We had long distances these samples traveled, in our case for clinical studies, from Singapore or from Brazil. They came into our lab, we measured them, and we thought this can never ever come from a human being. So we started in our daily talks in the lab, we started call some of these samples actually alien samples, because the measurement was so out of range. So then we looked for a solution first in the transport and then going deeper and deeper, and we realized you really have to monitor the whole chain, the whole process from patient until lab arrival. And this is what we do. So actually, if you look into a lab, the lab has really changed in the last years, 100 times faster, 100 times more precise. Why? Because it has been completely digitized. But this digitization has had a focus on the lab itself and not on pre-analytics, not on the area between sample collection and lab arrival. So this is what we're doing as a startup. So our solution eradicates the error that is still in the diagnostic process. The bulk of the errors, due to the digitalization of the lab, has shifted to pre-analytics. 70% of all the errors are happening there, which mean it can be an error in the transport. Sample gets too warm, sample falls down. It can be just the wrong sample tube, the wrong container, the wrong barcode, the wrong filling volume. The sample cannot match to the order, or it can even not match to the patient. So for all of that, we have created a solution. This is how our solution looks like, but I know that I don't have enough time to actually go into detail. But the interesting thing is it fits to what patients want. It fits to what phlebotomist wants, and it fits to what the lab wants. And that is a full chain of custody. And why? Because I think we all agree that this is the data source of the future. This is what will drive precision and personalized medicine. This is where you get your data for high sensitive tests for the future of medicine. And this is what we need to fight a pandemic. So basically, what you need to control in 2020 and in all years to come, you need to make 100% sure these are safe and completely monitored from time point zero until lab arrival, until they are in a fully standardized and controlled environment. So this is what we do as a startup. We have been working together with EIT Health from the very beginning onward, and that has helped us a lot. They have spotted this as a great idea more than 2 years ago, when nobody talked about Corona and when pre-analytics was not on the scene. And they have led us through these last 3 years, and now our products are running. They're running with leading hospitals in Germany, and now we're trying to bring them to Portugal, to the UK, and to the Nordic countries as a next step. And so we aim really to change diagnostics from trust to evidence in Europe. Jorge, question. Shall I jump to the second point, my learning?
Thank you very much for that nice presentation, Hans, and for sticking to the time. You know, really part of this transformative journey, trying to let's say make things digital where it makes sense, and obviously, you know, it does make a lot of sense, you know, to try to to know exactly the quality, you know, of the samples that we get. The technology was available, and then I think you're doing great work. You know, the market is rewarding you, so I will not get into that. I'm interested more in the problems, because, you know, as you said, you know, we are already, you know, up and running in Germany. We are entering Portugal, the UK. What are the, you know, and I'm gonna, you know, more than pinpoint to anybody, you know, just think in terms of healthcare system perspective. What are what are the big barriers that you're, you know, if somebody tells you, gosh, you know, I could, you know, if I could get rid of this thing, you know, please make it disappear, Aladdin, what would that be?
Yes, I can refer back to what Julia said. I mean, if a hospital decides to have no data going out, and that, for example, we would need to use the hospital server, it's extremely difficult. So data privacy, data sharing, and in accordance to all standard procedures, this needs to be harmonized, and this needs to be open for innovation, to also bring innovation where it's needed, because a lot of innovation in diagnostics and in healthcare has to do with data. So the right to access data and to share the data where it's necessary and needed, this is a key for us.
Very, very, very good. How much, let's say, let me ask a second one. How much of your time, you know, do you think that that you spend on the product, on the technology, let's say, and how much of your time you or the team, let's say, you spend on the, you know, on the actual, you know, convincing, you know, solving all these, you know, things that are misaligned, you know? What would you say?
Yes, a startup can only be successful if it talks to the customer and if it understands the problem. So if I develop a product which does not fit the customer's needs and the needs of those working with my product, I guarantee you it will fail. So the most time that we spend is out with the phlebotomist. We want to see how the phlebotomist works, and they all work different, from lab to lab, from country to country, from collection site to collection sites. So our idea and our aim in the end is no single change in the process, as fast as possible, as convenient as possible, and generating the maximum benefit for the phlebotomist, those collecting blood, for the patient, the healthcare professional, the lab, and in the end, the healthcare system, because this is where the main bulk of the cost of the pre-analytical error is buried.
Excellent. Thank you very much, Hans, for that. And then I hand it over to Luis. Let's hear from Luis Valente. Thank you very much, Hans. Let's hear from iLove, Intelligent Lab on a Fiber.
Hi, can you hear me?
Very well, Luis.
Hopefully.
The screen is yours.
Thank you so much, Jorge, and thank you to EIT Health for having me on this session. It was great to hear Hans mention about blood as the data source of the future, and as the basic building block of personalized medicine. We really believe on that vision too. We really believe that the way medications and drugs have been developed for the past century, it's unfortunately outdated, and it's unfortunately not working. So most medications are actually, they're done with the assumption that they work for everyone on the same way, and actually for many decades that has been working fine. You test a medication, you do a clinical trial, you take it to market, and hopefully it will work for everyone that has that same disease. But unfortunately, some of the biggest challenges that we still have to face on a healthcare perspective, some of the biggest diseases that are still uncurred are now heterogeneous complex diseases for which one treatment will not work for all. And there is indeed a need to find data sources of the future that can allow for developing tailored medication for specific biological profiles, that can allow these medications to have or to pharmaceutical companies and the hospitals and even to physicians to have a greater knowledge about how persons will react individually to those medications. And this is the heart and soul of the problem that ILOF is developing. So basically, ILOF is creating a platform that comprises personalized biomarkers and biological profiles in order to select the right patients for clinical trials, so that eventually, of course, it can be used in personalized treatment, into selecting the right treatment to the right patient. And again, so digitalizing the whole process, and unfortunately clinical trials, it's still I would say one of the areas where a lot of work has been done in the recent years, but a lot of work is yet to be done also in the upcoming years. So I believe that we have both an opportunity and a challenge regarding digital transformation. And even with COVID, we felt that we're partners that just started working with us with our personalized platform, because the other tools that you're using, and in some cases, for example, they were using consumable based, antibody based tools. They are not, I would say, not so digitalized, and that they suffered a lot with COVID. There were delays on production, and they turned to a digital solution like ILOF, that basically just uses a technology based on photonics, which is light and AI. So we were, I would say that our platform was not so affected by the production setbacks or bottlenecks of COVID. So yeah, regarding, and this has been talked by widely by a lot of people this morning, but I would say that they're both challenges and opportunities for digital transformation in healthcare right now, and for SMEs, for startups like ILOF. I like to think that the opportunities are bigger than the challenges, especially with COVID, and at least this is what we've been feeling. Yeah, so this is just an example of an opportunity and the challenge of an SME. On one hand, there's the opportunity of being able to speak with more people, to pitch to more people, to meet new partners and new investors on a virtual level, like we're doing it right now. But on the other hand, there are some areas where work still needs to be done. The labs still need to function, and doing that on a pure remote capabilities. It's a challenge. It's a challenge, and has been a true challenge for us. So yeah, over to you, Jorge. I'm sure I already extended my time.
Thank you very much for that, Luis. No, indeed, we're on time, so no worries for that. Very interesting. I mean, I forgot to mention, but ILOF has been, recently recognized by Civic Insights as one of the top 150 digital health companies in the world. basically people, transforming, let's say, the way medicine is done. So congrats on that, and to the team. But let me hear from you. What are the, same question that I put to Hans. What are the challenges that you face out there? What is the one thing that, hey, if I can get rid of this, that would be perfect? Share with us.
Absolutely. So I'd say it's still hard for an SME, especially when we're dealing, and again, so we're B2B. We're dealing with large, huge corporations, and it's sometimes still difficult to really understand who should we be talking to. So who is the champion? Who would be the champion of this solution? Who really wants digital transformation to happen in the organization? Who doesn't? Who is the anti-buyer? And for an SME, for a startup like iLove, to really detect those profiles in huge, large organizations, it's still difficult. And I believe that it is in their best interest that startups like iLove bring innovation into big corporates. This is I would say the recipe for many successful things that have happened in the past few years in healthcare. So I believe that it would be in the best interests of corporates to really have, or to give more visibility to the right potential partners about the way that decision making is done within corporates. Right now, I would say it's very trial and error. You go and you find your champions, and sometimes they're anti-buyers, and you're trying to find anti-buyers, and sometimes they're champions. So I would say that it is indeed a challenge, and to have more visibility, especially in, again, big thousand people organizations, to have more visibility about the decision-making process. It would benefit all. It would make these big corporates move faster and accept innovation also in a more smoother way, and it would also help SMEs in their path to bring innovation to the healthcare market.
Very interesting one, because indeed in the B2B market, that is a real challenge, finding those, let's say, those people, who can really leverage your efforts. Very good. Let me ask a final question to both of you, okay? And the question has to be a number, okay? So basically, from 0 to 100, okay? Let's create this index called digital readiness in Europe, okay? In your experiences, because you've been doing business not just in your, where your companies have been founded, but across Europe and other geographies as well, right? What number would you give? Let's say from 0 to 100. What's the digital readiness score of Europe now? Very subjective. Who wants to go first?
Over to you, Hans.
All right, I can go first. 31.
31. Okay, very good. Do you want to explain the one?
That's the hope.
That's a good one. So 31% for Mr. Hans Maria Hein. Very good. Luis.
I'm a little more optimistic. So I would say 49. I would say we are. Halfway there, but again, it's an optimistic view. We're not halfway there. Hopefully, we will be soon. But it's great to see a lot of organizations like EIT Health really pushing for this digital transformation, and this just makes me very hopeful of the future.
Very good. So between 31% and 49%, we'll run a study on this digital readiness in Europe. Very good. I thank you very much to both of you. Don't leave us, because I will call both of you on stage. But let me just move to our last question, to our last poll to the audience. And the question, if the team can launch it, is precisely around those barriers that we've been telling and asking Hans and Luis. So which topic do you think needs to be most transformed to achieve the full benefits of digital health? Okay, so what is the thing that needs more transformation, more transformation power onto that, right? And the 5 possible answers: data sharing and privacy first. Second, infrastructure investments. Number 3, reimbursement. Number 4, workforce skill mix. And number 5, patient education. Guys, Luis, now over to you. You were so polite to allow Hans to go first. What is your voting for this one?
So in my case, it's absolutely data and data interoperability. So, but again, it's also a matter of what's crucial to our business and the pains that we feel every day. The way data is collected, shared, the way data works between different systems, it's still very different. And I'm sure Hans feels the same way as I do. Getting our systems to work and to collect and send data to a lot of very legacy systems in some cases. It's a challenge, and I believe it's one of the areas to grow on.
Very good. Hans?
Yes, data sharing and privacy is the top issue by far. Yes, and we also, I mean, workforce and skill mix is also important, to be honest. On both sides, on, let's say, the development side, on the people using it, because I would say technology is nothing without control. Technology is nothing if those that should use it cannot use it. But data sharing comes clearly on number one.
Very good. So that's great. Now I've learned that there is this open thing where I can see things moving on, and I can definitely share the final results. Hopefully, see if I get there. But very, very similar to what you're saying, right? So almost 50% of the audience thought that the place where the field where there is most needed transformation is in data sharing and privacy, right? It's interesting because we've been doing lots of stuff in Europe, GDPR, lots of different rules, but still I guess that there's some nuggets to crack there still. And then the second one was precisely the one that you were mentioning, Hans, workforce skill mix, right? So 19%, right? So between both of them, close to 70% of the places where that's interesting. So that's really, really, really good. So thank you very much for both for being with us on screen from Munich, Bavaria, and from Porto, Portugal, right? And then we've closed these three things. And let me ask all the panelists to join me on the screen. I like to do a brief, let's say a brief summary of what I heard, because I think it's always important not just to hear and learn, but also to reflect, because that's a way where things, they stick to the thing. We started the presentation today with Julia, sharing the example of Germany. We didn't choose Germany because it's the best example in Europe, but we use Germany because it is the country in Europe that is transforming the most, right? And then in a period where you want to move from one place to the other, what you need is to transform, right? And then I think Germany is doing good work. I'll bring with me three things that Julia said. So she said, nothing was easier than expected. Okay, so bumpy roads ahead. Buy lots of resilience and grit in the pharmacy or in the supermarket, right? Innovation is not for the scary ones. That's the first one. Then the second one that you mentioned, the importance of talking to different people, multidisciplinary. That alongside with Lydia, right? You mentioned that the importance of getting people in here, the different voices, and that was very important. And then also this commitment of we're just in a journey. The first part was the DIGA, right? But now we got into the we're talking about the let's say the hospital, right? And that's this is an ecosystem that we need to transform. It's not just about single pieces there. So that was very good. Then what I took from media was this concept of interoperability that shows up a lot, right? And that the importance of how can we think through it carefully. And between the both of you, you said don't make good enough the enemy of excellent, right? So whenever we are improving, we are better than we were. So that's very important to move forward. So that was excellent. And then also, the importance of where is the data being stored, right? Because this is a conversation, that we always have, who stores it, for what purposes, etc. Right? And then there's some interesting cases like some, which is not just let's say the case proprietary for Germany or Bavaria, but hospital data not being able for legal reasons to leave the the premises of the hospital setting, let's say, right? So that was good. And then we move on to Hans and Louis, the startup people, and on top of presenting the work they're doing and the companies that they're building, which are really transforming the way healthcare is delivered and the way healthcare systems are running. They share a couple of things which bring home very interesting. The first thing from Hans was this idea of you need to talk to your customers. This is if they're going to be using this is key, right? So the technology conversation is important, but what is important is how do you do it? And then, as you said, it is not just that the backgrounds and the brains of our people are different. It's that across many places, the processes we have built in organizations are totally different, right? And then that's a real challenge that we need to adjust to. That was the first one. Both of you shared the importance of data sharing and privacy, so that needs to be be made. And then what I brought from Louis is the importance of companies like Atos and all the large players in Europe, right? Just publish your list of super champions, right? Not that, but basically, we need to know who are the people who are really transforming the world, because these are the people that they need to get that. If I remember well, Martin Luther King, he didn't say, I have a business plan, or I have an Excel spreadsheet, or I have a business model. He said, I have a dream, right? And I think, we need to move towards that dream of, building a different type of healthcare systems. And then this is where digital can transform. So before closing, I just want to give you one sentence to each of you. So the key message that you want the audience to leave us with, so they can talk to their wives at lunch. It will certainly help my life. So Julia, over to you.
So transformation is not easy, but we want to make it worth it.
That was good. Tweet number one. Lydia, tweet number two.
Sorry. Well, I think, as we said, we want this to be shared, and we want to really empower patients so that everything that they produce as data can be used for them and not against them.
Patient empowerment, very good. Lydia, thank you very much. Hans, tweet number three.
I would go a bit into Lydia's direction. I would say innovation can also be bottom up, and on the other side, get governments geared.
Very good. Tweet number three from Hans, very good. Luis, there you go, last one.
So I would say that digital transformation is going to happen. Either way, it's inevitable. You might as well join it and assign resources from your organization to really make it work for you.
Very good, very good. Well, so thank you very much to everybody. My tweet would be, we've done a lot of things, but there is still, things that we need to do. And I think it is better together than alone. And EIT Health as an organization is proud of supporting, this type of journeys and others, but we're not the only ones. So there are other, people in Europe doing this, the type of work that is needed. So I'm really happy that we're moving forward and, we're playing this game. So thank you very much to all of you. It's been a pleasure from sunny Barcelona. And I hope you have a good end of the day, everybody. I want to thank again Gastein Forum for the opportunity to present and for all our people here. So have a good end of the day, whatever is Monday afternoon or evening, wherever you're listening to us. Thank you very much and have a good day. Take good care. Bye-bye, everybody.
Thank you.
Thank you. Bye.
Bye-bye, everybody.